Senate Bill SB 1045. Short title, Defined Contribution, Health Subsidy, Disability. And it was introduced by Senator Livingston, and it will be heard in the House Government and Elections Committee on Wednesday. Now, this bill passed handily in the Senate. The vote was 28-1. Actually what this does is it creates a brand new health disability benefit for those that wish to participate in it. And it has to do with the public safety personnel retirement system. In fact, I'll read the description of it. Requires the public safety personnel retirement system, that's a PSPRS that you hear about, Board of Trustees to establish, design, and administer a group health benefit plan to provide statutory prescribed group health benefits for retired participants who make an election to participate. So it's a brand new program. There's no indication here that this would be self-funding. As a matter of fact, somewhere in there I read that that's going to be about $100,000 that will cost the taxpayer initially. It will be $100,000 that would cost the taxpayers a year. But we know what happens with all of these programs. If it's underfunded, where do they go for the funding?
Mm-hmm.
My wallet.
Your pocket and yours, yeah.
Okay, so I am not clear as to what why we need this, why we don't, what's wrong with the system already in place. So I have, my opinion on it is that I am not sure. So when I send my request for people to contact legislators, it's going to be one of those where I say, I don't have enough information, I don't know. Now, maybe Archie can shed some light on it, but my recommendation on that is that you're gonna have to read the bill and make your own judgment.
I understand. Now,
So do you have something to, he always has something to, I don't know why I even ask.
well, I don't know that I necessarily have a major, problems with the bill, but by the same token, when you read the Senate fact sheet on it, and it's telling you what the bill does, says the statute requires the Arizona Department of Administration to establish group health and accident coverage for former state employees. That's not current state employees.
This is for retirees.
I understand, but I mean, when you are currently employed, you have a health insurance plan that you're covered as a current state or county or city employee. So why are we creating a new one now that is not, as a retired employee, you're now losing the health insurance benefits that you had before, and now they're creating this plan for you to opt in. Why would you do that? It makes absolutely no sense. This is an optional program for you to opt in, and they're going to take a percentage of whatever money you receive in your retirement benefits and put it into this program, and then your employer, whatever department of the state fund or county city fund was that you can opt into, and they're going to pay in an additional 3%. So 6% is going in to cover this, right? Now, I suppose there's no major problem with that until I get over to the fact that this trust that's going to be created, and there's a provision, it says, notwithstanding subsection A of this section, if the board dissolves the trust created pursuant to this section, any remaining assets shall be returned to the employers that have contributed to the trust in such amounts as the board determines. So if you're an employee and not the employer, and they terminate the trust, you've just lost the money you put in, but the board gets theirs back. So I think our legislators need to give some more thought to this. I don't know that it's a bad idea. A defined contribution program is good, but there's some weak points on this one, and I think
That
they
is a
need to
very
cor-
weak point.
I think they need to correct it.
And it will be easily corrected, because all you have to do is add 2 words to that provision, okay?
Mhm.
To the employer and employee.
That would help, yes.
Yeah. If that were the case, I would be more than likely to say, okay, this is a good bill. As it is, I'm gonna say, I don't know for sure. Do what you want.
No, there's no guarantee under this that it's going to be self-sufficient, self-funding either. And it's just another bill. You have to understand that almost all of the public pensions in the state of Arizona are grossly underfunded.
Yeah, that's another thing. The part of it is going to be supplied by the employer, but what is there to make sure that they do not underfund it, just like they've underfunded the rest of the PSPRS retirement system?
Yeah, I mean, almost all of them, of the pension plans in the state of Arizona, the public pension plans are underfunded. And some of them are only funded to the extent of 60%. So that means if something happens, you and I are going to have to reach into our pocket again and try to make the employees whole. I think they need to do something about making the pension funds, fully
Solvent.
funded. Yeah.